we're walking down the hall, and we have our nurse manager for the oncology unit, Marie Rogenkamp, and Marie's going to give you a little overview of the space.
Hi, Chris and Jen. How you guys doing? Would love you to come see my infusion clinic here.
First, we'll show you the sign on the door, too, and the door. And then Marie can go in, and then I will follow.
So this is a little gym in Huntington Hospital. It's an infusion suite. We have 5 lovely, comfortable chairs. And we treat all kinds of patients, from chemotherapy and infusions to hydration, and patients who may have had any side effect from their chemotherapy, so any blood products and such. And we actually have many patients who come here who've been here for over 10 years. And they travel far from out east, Long Island, to come to this little area because of the nursing care that they receive. We currently have one nurse who's in here full time. Her name is Trish, and she's been a nurse here for over 30 years. And she is just the love of the infusion room. And we also have a secretary in here, Christina, who's been here for about 10 years. And the 2 of them together provide world-renowned care. So we are more than happy to have your generosity, and if you ever want to come visit, please do. Maybe not COVID time, but I want you to know that this is a wonderful place for patients to come and feel safe. And we're a family here, as Huntington Hospital is, and this little gem called the Infusion Clinic is a wonderful place. So thank you.
Thank you so much. So the one thing I wanted to say is that all the chairs also, what are they? So if you come in for an infusion,
Yes.
The chairs have televisions, individual televisions, right?
They do, yeah.
Okay, so each chair has an individual television. We also just had a recent donor fund iPads. So we're going to be getting several iPads for the infusion room, so patients can watch Netflix and other things that will be available via Wi-Fi. But there are the individual TVs, and each chair has its own individual TV. So you're going to see Dominique again in a second. And then the room itself also has a recently renovated restroom, just for this room in particular. So I will go in restroom so you could see the restroom. It is handicapped accessible and renovated. And I think that's it. One more look at everything. And I think that was your little virtual tour. We do also have a patient lounge that is right next to this room, and there is a beautiful outdoor space and a patio, which I will show you from here, that is pretty extensive and large. And it's a really lovely space as well.
Of course, it looks much nicer in the spring when all the flowers are blooming.
Yes.
And our patients do get to enjoy it in the summer and the spring, and so sometimes your infusions could be 6 to 8 hours. So it's a long day to be sitting in a room. So we escort them outside where they can sit in the sun under an umbrella and read a book. So it's a beautiful place for them to get their infusions.
That's great. And then also I just noticed some snacks. It looks like there's graham crackers, and there's Chips Ahoy's and Snackwells, which are like my favorite. So they also can have some snacks. And that's it. Thank you guys, and we'll see you soon.